Okay, you roll over in bed and the whole world starts spinning. So you think you're gonna die, or maybe you're having a stroke, but it's actually just some loose crystals inside your inner ear. So there are some different causes for spinning vertigo or dizziness, but by far the most common cause is called benign proximal positional vertigo. So what's going on with that? Now, in the anatomy of your inner ear, you have the organ of hearing and balance. So on the balance side, you kind of have two parts. There are 3 semicircular canals on each side. They look like 3 hula hoops on each side, which senses the rotational movement of our head. And then outside of those canals, you have a room that senses the horizontal movement. And there's like a gel carpet with these little crystals that sit on top. So when you have benign positional vertigo, those little crystals will break free, float, and drop down in those little canals. And you get this false sensation of rotation when it's not happening. It can be really profound, kind of scary for most people when it first occurs. It lasts less than a minute, and it can be reproducible, meaning that you rotate again your head and it happens again lasting less than a minute. So what causes it? In over 50% of people, we don't know. We call it idiopathic. We think there's a correlation with age, maybe a breakdown of those crystals. It happens most commonly in people between ages 50 and 60, and over twice as common in females than males. Sorry, ladies. When we do know a cause, it's usually trauma, which makes sense, jogging those crystals loose, followed by a viral infection of the inner ear, Meniere's disease, maybe migraine headaches, vitamin D deficiency, osteoporosis has even been identified as maybe a factor. Now, how again do you confirm it's really a crystal problem? The key again is that spinning, which is triggered by head position, whether that's rolling over in bed, laying down, looking up, bending over, and it stops when you hold still. It lasts less than a minute. It may still be a little bit queasy, but will last less than a minute and have no other symptoms. If people are looking at you, they can actually see your eyes twitch. We call that nystagmus. Okay, so you've got it. How do you fix it? The treatment really is aimed at trying to roll those crystals back into position, back into that room, and then settle in that gel that they broke free from. We do this by a series of head positions. We do this in our office with ENTs, audiology groups do it, physical therapy groups do it as well. And it's effective, over 80% with one treatment, 90% with multiple treatments. No surgery needed, no medications. So any red flags with this? There can be. If you have other ear symptoms or other symptoms in general related to hearing loss, facial weakness, constant imbalance, you'd want to see an ENT. It's probably not BPPV, there's something else going on. Okay, so if the room spins, when you roll over in bed, your crystals are loose. Come in and see an ENT will help roll them back where they're supposed to be. So now you know. If you like this video, please share it and follow for more.